Well, good morning. Good morning, everyone, and welcome to our Workforce Wellbeing webinar. Today is about actions. It's about actions to provide immediate support to our exhausted health and care workforce. And in discussing actions, we'll touch on a number of other relevant themes. We'll touch on workforce integration and workforce recognition. And we'll talk about funding as well in terms of how to make all this happen. I'll welcome the panel in a minute and thank everyone for being here, but it might be better to start with just a bit of housekeeping, as you do, in any good webinar. So the first thing is the meeting is recorded. I think everyone was aware of that when they choose to join, and will be shared. The recording will be shared after the event. We would recommend everyone to go on speaker view on Zoom, so you can see the four of us, the panel on screen. And that's what the setting that we chose. So to have the panel on screen at any time, so we can interact through the conversation. It will be an interactive conversation. We'll try to make it as interactive as possible with the audience, with all of you. And a big thank you to everyone for joining, and the people that are about to join in the next few minutes. The chat is enabled, and everyone is welcome to keep it going through the conversation. At the end, we'll save about 15 or 20 minutes for Q&A. So we'd welcome everyone who wants to put questions in the chat. And then we've got the team behind the scene who's going to select a few questions that are going to go to the panel. The question we won't be able to answer, we'll answer them in due course and after the webinar, but no questions will go unanswered. And please, let's make it as interactive as possible. Any issue, put it in the chat, and there's a support team behind the scenes again that is going to pick up any Zoom issues or any technical issues you might have. So without any further ado, a very, very warm welcome to our panel this morning. Professor Martin Green and Chief Executive of Care England. Probably neither Professor Green or Care England need any specific introduction. Just a big thank you for being here. And if I may, just a reminder that there's a Care England conference coming up, and I'll remind at the end of the webinar as well, on the 23rd of March, where we're going to develop, well, Professor Green and all participants, including us, will help to develop the conversation we're going to have today. And it's the 23rd of March in person in London, the Care England conference. Professor Deborah Sturdy. Deborah, thank you so much for being here. What is wonderful, I think, about having you here is the different perspectives that you're going to bring. You're a nurse, you've got a lot of frontline experience, you're the chief nurse for adult social care, you've got a lot of social care experience, and in a way you represent the Department of Social Health and Social Care as well, which is if I may say, your employer in a way. Correct me if I'm wrong. So the three perspectives are going to be particularly useful today, and thank you for being here. And Nicola, Professor Nicola Ranger, Chief Nurse and Executive Director of Midwifery at King's College London. Well, in terms of frontline experience of the last 2 years, I think we could ask for anyone better to just share what is going on and how it feels with the many thousands of people that Nicola manages in one of the highest profile NHS trusts in the country, King's College in London. Big thank you. I'm Alessandro Alagna, Director of Talent for Care. Our passion is for transforming workforce, support, well-being, and ultimately sustainability and retention. And if you're a bit intimidated by the panel with three professors on the panel, you please have some sympathy for me, because I'm here to try to ask some smart questions to them. And I would appreciate if everyone could help me along the way. So without any further ado, let's start with workforce well-being. The last 2 years, it's obvious to everyone what we've been through. But may I ask, how does it feel in the front line? Maybe Deborah, Nicola, Martin, what is your experience of what is our workforce well-being status at the moment after 2 years of this pandemic? Deborah, I don't know if you wish to go first.
Yeah, very happy to do that. And morning to everybody, and thank you for all you've been doing. I say that all the time. It feels like it's never enough, certainly not after the kind of extent of the pandemic and the length of time people have worked so tirelessly through it. And I know that from my own experience, up until early last year, I was the Director of Health and Wellbeing at the Royal Hospital Chelsea. So I've lived the experiences you've lived on the front line about staffing, about how we're going to cover shifts. I actually moved into the hospital for 4 months. And I know what those very, very long days are like when you start in the morning and suddenly you're in your office and it's 11 o'clock at night and you think, how's that kind of happened? So I know that kind of physicality and the impact of that kind of exhaustion you feel, but not just physical, it's the emotional stuff that everybody has dealt with, because it's not just being at work, it's about our own families. I had an elderly mother I was coming home to one night a week to sort her out before I went off again. So it's all our families that have had to adapt to us kind of carrying on working through this. And I know that the kind of personal loss that some people have experienced from both colleagues and actually, and people's own families as well. So, and I certainly dealt with a lot of bereavement within the workforce during that time, and the people, small number, but the people that we lost. So I think that kind of bombardment on our emotions has been really, really intense. And never more so when often I was at 11 o'clock at night writing an email to one of my colleagues who was in ITU at the time with COVID, and it was a miracle that he survived. But I used to write him emails a couple of times a week, and they used to read out to him, and I know he kept those in a book afterwards. So I really understand that. So, but it's not just through COVID. I think it's what we often don't recognise, particularly I think in I think across the system, but in social care, is around the kind of emotional bombardment, the emotional intensity of working with people, and the way that we do. And I think in social care, the kind of long-term relationships you build with people. So, I think it's not just the pandemic, but I think one of the things we have to do is take note of all these things and learn and move on from them. We were talking before the start of this, Professor Irene Gray, who's been involved in setting this up, was saying, we need to talk positively about how we take this forward. And I absolutely agree with her. It's how we learn and how we make it better from now on.
Absolutely. And actions as well. We said, we try to be focused as much as possible on that today. Thank you, Deborah. Very clear, very useful. Martin and Nicola, what's your view from the front line?
Well, I think, Deborah has really eloquently outlined the challenges that people have undergone during this really unprecedented time. But I think also one of the things that's really come through and been recognised in a way that wasn't recognised before is the commitment that social care staff have shown to the people they support. And as Deborah said, this has not been, it's been both physically and emotionally draining, because Deborah's point about how people in social care develop relationships with the people they support, because they are long-term relationships. And so every time somebody is lost, it is a bereavement. I think also the point Deborah made about how at the start of this pandemic, I think we should remind ourselves that there were no vaccines, there were no support mechanisms, and people were going into their work to support the people that they were looking after and then going home to their families. And they were putting themselves and their families in danger in order to do their job. And that was really stark for me. The commitment that those people showed was truly outstanding. And I think also one of the things that I really hope comes out of this pandemic is that we learn some lessons about how to support people in the very worst of times. And I was doing quite a few visits to care settings virtually, obviously, because I couldn't go into them. And what was very tragic to me, I was once on a call with a staff team who had lost 7 of their residents in the space of 70 hours. And I was discussing with them what had happened. And what was tragic, there was one quite junior member of staff who said to me, "What did we do wrong?" And then I realized she was carrying not only the emotional baggage and trauma of what she'd been through, but she was also in a way blaming herself. And as luck would have it, there was a relative of somebody who died, and she jumped in and said, "You did nothing wrong. You were there for my dad and you were there for me." But it made me realize, we must go through this and look at how we support people when they have been through what I consider to be a trauma. It's quite interesting. If you'd been through this and it had been a war and you'd been in the armed forces, there would have been a whole raft of support mechanisms for you. There would have been thoughts about how you were supported, about what your mental health needs were, about how you got access to counselling. And there has been very little of that in both health and social care. And I think we need to really remind ourselves, this was a trauma equally as challenging as some of the other traumas that people have gone through, in war. And we need to respond to that with a really coherent response that takes account of people's well-being.
Absolutely. And a couple of things. We're talking about health and social care today in a truly joined up way, aren't we? Because we're all equal in front of this, whatever our perspective is. Nicola, what is your perspective after having spent the last 3 years in the middle of this?
I fully support what both Deborah and Martin have said, but I think it's important that we probably acknowledge that the waves have been very different as the time's gone on. The very first wave probably had a really, really difficult effect on social care as hospitals were emptied. That's the honest truth. After we saw pictures of Europe where people were running out of ventilators and CPAP, I think the whole ethos was make some beds in the hospital. And I think on hindsight, we can see the damage that has been caused and how that's made people feel. But I think in the first wave in a hospital, I think people felt all hands on deck. It was challenging, but everything else stopped. So people were able to focus primarily on patients. And if I'm truly honest, I think people, in a very strange way, there was a very strong sense of camaraderie in a hospital, and we were being clapped every Wednesday night. And so I think in the beginning, this was something new and different and tragic, but people really pulled together. Over time, that has changed. Over time, the massive human impact that Martin and Deborah have described is absolutely real. People are living with not feeling they gave brilliant care all of the time when everyone was struggling with staffing and how we're going to look after the patients. I think people really, really started to be concerned, and the real human impact of being separate from their families. A lot of our nurses and midwives are from overseas. They've not been able to see their own families. We're in countries where they're worried about their own family members. So as time went on, I think it's become more difficult for people. And certainly in the second wave, if I think of before Christmas last year, we had about 80 patients with COVID, the big 3 weeks into December. And by 2 weeks or week, 5th of January, that was up to 780 COVID positive patients. That has had a massive impact on people. So how are people feeling now? I think they are fatigued, but if I'm honest, they're also desperate for some hope and want to see the future. Because I think what I've been most impressed with is how brilliant people are. There is story after story of people going over and above the call of duty, and the care for patients is absolutely paramount and still what I think the majority of people want to do. But what they're fatigued by is everything around them. The lack of, I think education is going to be key, time off, feeling that there's a future. And so I think for me that it's absolutely important that we start talking about some optimism so that whether you work in a hospital or care home, you still feel that there's a future. And I think we've got a limited time to do that. And if we don't give a little bit of feeling around that, I think people will walk. We know that vacancies in the health service, and I know it's the same as social care, have gone up in a year about 23%. So we've got a serious problem. I think our vacancies in both sectors are the highest they've ever been in history.
Absolutely. The picture is very clear. So let's talk about actions. What can be done? The pandemic has brought all this to the fore. Some of it was there already, has been there for a long time. The pandemic can be a turning point in many respects in the way we look after our health and care workforce. What should we do now? And then maybe we can think about what we can do on an ongoing basis. But the need is here and now, as we're clearly saying. So, over to all of you, really. What do you think can work now to provide immediate support?
Well, I think Dudley made some really important points in the chat, actually, about the first starting point for this has to be a recognition of what people have done and increasing understanding about the fantastic work that has been done and giving people a feeling that they are valued. And that can be a start point. There are a lot of tangible things that we need to do around, particularly, Nicola made the point about people needing time to have time off, to get back into education. Also, I think to have time to reflect on what they did and process that, because I think that's a really important point. Some people might need something tangible like counselling and support. I think there's also a really interesting point about how teams supported one another and how we can use that as an opportunity to think about new models where teams come together to support one another, and that becomes business as usual activity rather than crisis activity. So I do think there are lots of tangible things that we can do, but I thought Dudley's point was well made. It has to start with recognition and an understanding of what people have been through, and we need to build from that.
I also think, and I can see it in the comments, I think it's absolutely right that we've got to increase the public image around social care. I think that will have been fed recently with some of the narrative around social care, low cost, low skill. That is not an appropriate statement to have been made by anybody. And I think that's probably also going to have been fed by the pushback that rightly social care gave around the vaccine, and it carried on, and then the NHS gave the pushback, and it was paused, or is paused at the moment. I think it's absolutely vital that we start to really get this narrative right and better. The NHS and social care are totally symbiotic. You can't have one without the other, and it's how do we, both in how we speak and how we act, try to get that far better. And I'd really welcome views, as part of this, as to how we do get that better, because I think it's absolutely key.
And I wouldn't disagree with anything either Martin or Nicola have said. And to that end, last year when I came into this role, initially as an interim, was to launch the Chief Nurse Awards, and those recognition awards have been so well received. So we've been doing that work, and we're just kind of relaunching them, going out and asking people, because I know that Omicron has kind of put everybody back again in terms of the focus. So that's really important. But I think it's also that levelling up thing around honours more generally. So seeing more of social care. One of the things when the honours come out, you see this plethora of NHS colleagues rightly recognise what they do, but we need to see that kind of equality around social care. But I think it's some of the kind of smaller things that we can do as well. And I think Martin talks a lot about how organisations, I know through the pandemic, have really stepped up, and lots of them have supported their staff. I don't think I've ever spent as much money on cake, chocolate, and goodness knows what else when I was at Chelsea, because those small things really do make a difference. So that recognition at a very local level is important as the national stuff too. And I'm really, and also Nicola talking about hope. One of the things that we do have in terms of hope is we've had the social care reform agenda announced now, and a fund for 500 million for the workforce. And in that is a whole basket of things. Back to Dudley's point about how we support managers in particular, we see a 40% turnover of managers in this sector. They are the absolute lifeblood and vital to stability of the workforce, to care quality for the people that we look after, where, if that's in a care home or in domiciliary care, supported living, wherever, they are absolutely the lifeblood and so important to help and support their colleagues who kind of do really vital things. So within that kind of package, there are lots of things, but perhaps we'll pick that up later in the conversation.
And changing. Sorry,
Deborah, can I just also pick up a point that Gilly Hunt made in the chat? I agree, Gilly, we've got to have some kind of registration scheme, but I want it to be an end point, not a start point, because if we get a registration scheme where you just register somebody and you don't have the skills and competency frameworks, the training monies, the support for people to be able to be in control of their own practice. And I think if you look at things like registrants in nursing, for example, there is not only an expectation that they have the responsibility for their own practice, but also there are plethoras of support around them for continuous professional development, etc. So for me, I want to see registration, but I want to see it as the last element of a complete root and branch reform of how we support people, recognise their professionalism, and also put them on a journey of continuous professional development, which is properly funded and they have the time to do.
Absolutely, absolutely. And well, there's a few thoughts that we'd like to share on that as well from our experience on the front line, if you want. But I'd like to go to, we talk about integration of the workforce. We talk about recognition, potentially registration, but integration. And Nicola, I know we had some thoughts with you before you shared some thoughts before the webinar about this. Would you mind to go back to that? Because I think what you suggested was just wonderful.
Yes, we're starting, we're really thinking about what we can do to retain staff. And I hear loud and clear, it's certainly in my organisation, it's education, education, education. People want to be brilliant at what they do. So we've just had agreement for a King's Nursing and Midwifery Academy. And one of the things that we're going to make is the principle is it is easier in the NHS because of volume to be able to do things at scale. And one of the things that the principle will be is that any course we run, we want to be open to our social care colleagues. So because it's just sometimes if organizations are smaller, it's cost effective that we can offer free courses, because I think that would certainly make a difference in Southeast London. I also think, if I'm honest, it hasn't come up on the chat, but I do believe this. I think that regulators have a part to play. I think sometimes what gets people down is when they've strived really hard to do the right thing, and sometimes it can feel just a criticism externally, and it's how do we, that also I think drops morale, particularly when people have been in the front line day in, day out. Someone coming in, and they've not been present for 18 months or so and then criticizing can feel really, really hard for organizations. So it's the framework around organizations, whether it's the HSE or CQC or other regulators. How do we make sure that people are fully supported in the environment in which they work and practice? Because I think it's very tough.
I agree.
Absolutely. And Nicola, I always say we're going to take away actions, all of us in a way, from today. I mean, what you just suggested is an example of something that can be done without the need for specific funding, and can be done by a lot of your colleagues across the country in a way, you're setting the example to say, why don't we start to really join up the training and join up, the conversation, meaning we move away from this low skilled, highly skilled conversation. We move away from this, there's more money here and less money there. We just try to do something together very pragmatically. We'll take it away, if you don't mind, from today, because it's an absolutely wonderful suggestion. Going back to what can be done now, Deborah and Martin, the expectations, I suppose, are going to change. They're different now, but they're going to change for years to come as well, in being able to attract and retain health and care professionals across health and social care. But having in place a well-being structure or a well-being infrastructure of some sort will be very much what people expect, however long there will have been in health and social care. So if we look 2 or 3 years ahead, without saying 10 years plan, what do we think do we need to have in place to really support our workforce?
I'm happy to start with that one. So I think the sector itself, everybody has to, and it's a bit what Nicola said again, we have to change the narrative around this. We need to use different language. We need to, and it's back to my point that Irene said before this webinar started, we have to start being positive, because if we keep on doing the negative, all we're doing is staying in our spiral. So we all have to take responsibility for that. And as hard as that is, it's absolutely vital. And I think we have to, kind of take our own power over that one. So I think narrative is really, how we describe and say things is really, really important. I think there's a whole host of things we need to do. One of the things that nothing annoys me more is when people talk about jobs in social care and not careers. So that for me, there's something about how we, and part of the work that we are planning, how we develop a knowledge and skills framework, how we actually set out. I don't think people generally understand the career opportunities in social care, be you a registered nurse or a healthcare assistant. We need to tell those stories of the healthcare assistant who became the chief exec, or the quality manager. We also need to tell the stories of the amazing frontline care worker workforce who stay there and do amazing jobs as well. It's not that everybody wants to or will do that. I think we need to look at our structures and our opportunities that we offer people. So, be that to be an apprenticeship nurse or a nurse, a nurse associate, or again, back to Martin about that really brilliant frontline worker and giving people the right skills to do that. Those are vital things. And so I think there's a whole basket of things that we need to do around drawing people in. I think we do need to work closer with the NHS. One of the great things about my role is I have a line into Ruth May, so I go to the chief nurse of the NHS's senior management team meetings every week. I am certainly having some influence there, because I don't have to say, and what about social care? So I think just merely having a role that recognises the workforce, and although obviously I am a nurse, and that is my, that's the title of this role, my kind of remit is wider than that. So we're starting to see that. We're starting to see people, as Nicola said, recognising that you can't do one without the other. It's totally symbiotic. You have to do it together. So people are recognising that. One of my ambitions and work that I'm kicking off now with the new integrated care structures and the integrated care boards is, what I want to see is that there is a workforce or nurse lead in every one of those for social care, because you need somebody who's got some responsibility, accountability, and sitting around that is a board made up of social care workers. And so that we can actually have a recognised voice, that there is a touch point to actually talk about these issues and to influence the NHS. So not wait to be invited to the party, kind of invite ourselves to the party and be part of shaping that workforce future. It is vital. And I think the other great thing that we're seeing is it's a little bit of incremental change, is that Health Education England for the first time are looking at a 15-year strategy for health, for the registered workforce. It's starting with that, and for the first time includes social care. So we're seeing another step in the right direction, but there's a long way to go with this, but we do have a path ahead of us that we can follow, which is really, really brilliant.
And we've got an amazing commitment, Deborah, don't we, from everyone, and we've got some funding behind it. We'll go back maybe to that before opening up to the Q&A. Martin, over to you. I mean, if you look ahead, and you're certainly a visionary in many respects, how do you see support and well-being for the workforce of the future? Well, the present, but of the future, meaning the near future.
Yeah, I mean, I think, Deborah's point about reminding people there are careers in social work, in social care, and we need to remind everybody that you can do so many different types of work. I would also like to see some advanced practitioner level roles, just as we used to have advanced social worker roles, which kept people who wanted to stay at frontline practice in those roles, and they didn't have to necessarily go into management in order to pursue their career. I think we need to think about some roles like that for frontline social care staff as well. I definitely think we need to have some really clear career escalators so that people can be clear about what they need to do to advance their career. I would love to see as well, and you know, thank you, Nicola, for all you're doing to open up training, because I do believe that joint training is a really good starting point, not least because it gets people together. And when you get people together, they start to understand one another. And I think those are simple things, but I do think we shouldn't underestimate the impact of how important they are, because it gives an understanding of each other's pressures. And of course, also, I'd like to see much more of the approach to health and social care being seen in education, so that people are going to do placements, sometimes in health, sometimes in social care settings. I mean, with FONS, which is a group doing stuff around nursing, Care England developed under Deborah's auspices the care home, teaching care home, which I think is a really important part of this, to get people from different professions into care settings. And I know Deborah has always talked about, we need chairs in residential care, and we need to have some really clear approach to how we develop our system around education and development and recognition for social care staff.
I was just coming there. Is
pretty easy to do.
Sorry, Martin. I think the other thing is what's vital is research. We need the evidence base, because evidence actually talks at the table. So to that end, we've already commissioned, and it's been published, a sort of rapid literature review on the role of the nurse in social care. And we've got, I'm kind of chairing a round table about social care nursing research, but it will be the wider workforce. I've already stipulated that in the spring. So it's really important that we develop and get that evidence base, so that we can talk with authority. And we've not seen that.
I think that is right. As I'm sitting here reflecting of when I was first a chief nurse at Frimley many years ago, and I invited in for lunch the leaders of each of the care homes locally, the top 10 care homes that admitted patients to us. And if I'm really, really honest with myself, I was probably a little bit patronizing at the beginning of the meeting. I probably said, with regard to learning, what would be good for us to help with learning. And, when I look back, I cringe actually, because actually I talked about, diabetes, pressure ulcers. People already had that sussed. They already knew all of that. They were brilliant at it. What they talked about was, I think, far more sophisticated about what are we going to do when someone is that dilemma at 3 a.m, when the right thing for the patient is to stay put, but you've got a bit of a tricky family, and you've got the CQC questioning your decision making, and a hospital questioning sometimes your decision making. Is it best to send them in to hospital or keep them there? And what I found is what we needed to work on was nothing about skills. It was about those genuine patient-focused pathways. And that's what we focused on, relationships, and really putting in place proper care plans between us with regard to patients. It was nothing about skills. Everybody already had that. It was, how were we going to put the patient at the center of how we both discharged them and how we potentially kept them there, rather than keep bouncing people backwards and forwards. And I think what's in the chat, having advanced practice, clinical decision making, keeping the care where the patient is rather than sending it backwards and forwards. I think we've absolutely got to rethink this. We know that the pressure on all organisations is huge. With the waiting lists, it's going to be massive, and patients are coming to harm while they're waiting. It's heartbreaking that hospices are seeing cancers they've not seen in their hospices for 30 years because of the pandemic. So there's pressure on all of us, on our resources, but we're only going to keep people out of hospital where they want to be, not in and out of hospital, if we start radically thinking and working together. And it isn't about skills so much as being able to enhance higher acute skills to keep people where they want to be, rather than coming in and out of hospital. So I think it really is time to think about advanced practice, to think about how do we stop thinking about those organizations and putting patients at the center of what we do. I was absolutely ashamed when I got a complaint recently from a family, and they'd come in from a nursing home, and the state that we sent, we only admitted them for 48 hours, and this patient should never have come in. We should have worked together to keep the patient where they were, but we didn't, and they'd only been admitted about 3 weeks before, and they were bouncing backwards and forwards. And I think we've got to put more time and energy into properly thinking about how we look at what's right for patients.
And ultimately, all the investment we're talking about in supporting our workforce and joining up our efforts will lead at that, which is what everyone is passionate about, isn't it? Is ultimately the outcomes we're looking for are for the workforce first, but they are for everyone that you all look after every day. I would just like to say that, I can step back for a minute and just enjoy this conversation. If someone joined now, they'll probably struggle to think who's representing healthcare, who's representing social care. The way that you're all, bringing this conversation forward couldn't be more integrated, which if there's one small outcome of today, I mean, that's a good one. And if we could keep doing it every day, whichever side we come from, which doesn't really matter, well, probably, we'll move forward quite quickly. If I may, can I just remind everyone in attendance, put questions in the Q&A, because in a few minutes we're going to go, if you've got any, I mean, there's a lot of lively conversation going on in the chat. If you've got any specific questions you'd like to ask the panel, some of the questions we collected in advance, but, you're very welcome to do it now. So in a few minutes, we can go to that. I'll go back to funding in a minute. Probably the only thing I'd like, if I may, share in terms of what should be done now and what are we going to do in years to come. Well, our experience is delivering workforce support well-being programs to health and social care. So investing directly in people in the front line in a way that has not been done before. And it pays dividends, at least, from our point of view. When you look at some basic outcomes we measure, so when you think about sense of belonging and feeling valued, we capture it on all our support and well-being program. 85% of participants, being care worker, nurses, senior consultants, or whoever, have a strengthened, a stronger sense of belonging in their organizations, not just in the system, and they feel valued as a result of being invested, having had the opportunity to be supported specifically for their well-being and personal development. You talk about rebuilding resilience, you talk about preparing for an uncertain future. These are all relevant outcomes. If you want to pick one, the sense of belonging is the one that always strikes us the most. I don't know if anyone has got any thoughts on that, but investing in workforce generally pays dividends.
Yeah, I couldn't agree more, Alessandro. And also, one of the things that people tell me is that they want to be listened to. And even if it doesn't mean that they necessarily get what they want to feel as if somebody has listened, somebody has given due consideration to what they've said, and engaged them, if it can't happen, in a discussion about why. And so often members of staff tell me that they feel they're not listened to. And I think that's a really important part of getting people to understand they have a really important role, that they're being respected as professionals, that they're part of an organization that's a listening and developing organization. And when you start to listen to people, and particularly when you start to listen to people at the front line, it's amazing how many sensible things come out of the ether, which will enable better outcomes, sometimes as well with less work and less pressure on resources. So I do think that's a really important element of how we need to move forward, I think.
And we haven't prepared this, Martin, but you might remember or not, but we've done a survey on staff support and well-being, actually jointly with you and with Care England. And the two top answers that came out, I've got it on my notes. We haven't prepared that before. But in terms of what works for providing immediate workforce support, the first answer, 91% of respondents, listening to concerns and challenges of staff, engaging, letting everyone share. The second one, 71% of respondents, offering support and well-being programs directly to frontline teams, exactly the things we're talking about. Can we go, while we collect a few questions and we go back to them in a minute, can we touch on funding for a minute? Because it's a very important point Deborah made before. Funding is becoming available. If you want, this is probably one of the benefits of the pandemic, if I may say that, or like you using what the pandemic is making available for transforming workforce support and well-being. So Deborah, in terms of access to funding, and you're probably talking social care in particular, I will ask Nicola, how does it feel from her point of view? What can be done, or how can access to funding be made easier?
Well, it's not kind of, it's a bit more complicated than that there's a fund that you can just say, oh, can I have a bit of that money? But the social care, I think the social care reform work that's gone on aside the pandemic and that was announced in September and subsequent white papers, the reform paper been out this week. There was one just before Christmas that was about workforce reform, of which there, as I mentioned earlier, were £500 million to be spent on this. And the kinds of things that's looking at, well-being is very much at the heart of that. So looking at, things such as what counselling services, to Martin's point, coaching that's available for, what coaching would be available for managers because they're so vital. Looking at helplines, people do want to offload and want to get that support and get that signposting to other things, but it's not just generic, is specifically for this workforce and the challenges that people working in social care experience. And the other thing that several organisations I'm aware of have adapted throughout the pandemic, actually, or because of the pandemic, is mental health first aid training. So looking at that, how can that be cascaded further? So there is that, I suppose, awareness of all those things. And then there probably will be a fund. We're looking at a fund where people can bid for small bits of money to make a difference, particularly in those small to medium-sized organisations. But how all the mechanics of that work is being sorted out at the moment. And then the wider workforce issues around, again, we touched on this earlier, but a knowledge and skills framework, looking at that transferability of that kind of skills passport across health and social care is going to be vital. If we're going to really move this forward, what we've always done isn't going to get us to where we need to be in the future. We need to do things differently. But if we are going to have a workforce that traverses across health and social care, giving them those passports to do that. The point, there's a point made in the chat earlier about the kind of registration of the care workforce, and again, I agree with Martin. You need the skills, the knowledge, the kind of support behind that. It's not just putting your name in a register, although I think that's very important. But we need to do those things together to really make it effective and make sure people get both the recognition and the support they need, and actually we set the bar of what we're expecting people, and I think that's really vital. So there is money there to do all those things. That money, although it sounds like a huge amount, it's got to stretch a long way. But again, just acknowledging the work that Nicola's doing. There's lots of trusts doing that. Those sort of small things that make a real difference within localities. And I did put in the chat as well about this, a CCG up in the northeast that have commissioned 6 places on an advanced nurse practitioner programme, which they're going to evaluate to exactly play into Nicola's point. Actually, it's not about denying people access to secondary care when they need it, but how do you best manage people in situ, either as mission avoidance or expediting discharge, pulling them out of that acute care facility at the most appropriate time. So there's loads and loads of things within that that I think are some really good and new opportunities that actually do have some money attached to them, which but I think, and like I say, I think it's a mixture. It's that big stuff, but I think it's that stuff about how employers too actually think about how they support. And again, a comment in the chat around retention. If you've got good leadership and people who feel respected in their organisations, they're going to want to stay there. And if you don't feel valued, it's the worst feeling in the world. I'm sure we've all experienced it at some point in our career. It really does matter. And if you're the person who's out of step with a culture, which I certainly have in more than one job, actually it feels like a really lonely place. And what you're going to do, you're going to say, I'm going to go. So actually valuing and supporting the people you've got is absolutely vital.
Very positive message about availability and commitment, from the health and care system, obviously, to also fund some of these initiatives going forward, and it's going to be a different approach to workforce well-being in years to come. There's a very interesting question in the chat. Martin has already picked up, I think, in the chat. What does the panel think of the idea of a new type of worker who works in both health and social care, but based on a sort of rotational post?
Well, I mean, sorry, Nicola. I think it's a very interesting idea, and increasingly we've got to see people who are able to move across systems in the same way that citizens do. You know, people don't sit in a silo; they live a life, and what we need is to have colleagues who are trained to deliver outcomes. And I think our problem at the moment is we train people for processes and organizations, and we need to start training them for people and for outcomes. And also that knowledge of knowing how to support people in the most effective way. You know, all the things that Nicola said about making sure that what we do to people is for their best interest and delivers the best outcome for them. You know, and sometimes it's very tempting to say, oh, she's got to go into hospital, and not to recognize that it might be, for example, at the end of somebody's life, the best way of dealing with that will be to support them to be in the place that they know and love, surrounded by the people they know and love. But in a way, we've created a system that's all about process and all about organizations having their particular roles. And we've forgotten that the person needs to be at the center of this.
Yeah, I mean, I would really like to pursue the idea of rotation, because at the moment, I think retention is the key issue. And I do believe that the saying a change is as good as a rest for everybody. There may be people that are working in the care homes that would like to be able to work in a hospital for a while, and vice versa, because I think people are really wanting, particularly after the past 2 years, something different. And I think we should find a way to absolutely make that possible. I think it's absolutely key. The other thing I would say on well-being, what I'm picking up and what I hear, not all of it needs to be senior to junior, actually. We're doing a lot with peer support and learning sets. We're actually giving people the time just to get together and discuss amongst themselves, and then raise things that they want the senior team to sort out or to review, because and we're really in the process of trying to set up staff councils, because everybody wants a voice, and that helps well-being, I think. And also, I think I always get really saddened at sometimes at a local level what people think the senior team have said no to. So I'll find something bizarre, like someone will say, well, someone said I can't have that, like it's a new chair because it's ripped or something. Well, we can't have that because we haven't got any money. Well, who said that? And some of the things that frustrate people trying to look after patients are quite simple things for senior team to sort out, but sometimes people assume that we can't or that we won't. And I think there's a lot more around giving people time for peer support. The other thing that we're focusing on, I know it sounds on well-being, is trying to create an environment where people have a bit of fun again.
Absolutely.
I can't wait to be able to organise a massive party in the O2 for all my young and trendy nurses and midwives. I won't be there dancing away, but they will. And it's trying to create an environment where people have a little bit of fun again, because we know it's about the teamwork, it's about the people you work with. And the other thing we're doing a lot of focus on is off duty. How do we give people a really good work-life balance? Because I think we need to get that a little bit better, actually.
I love the concept of fun. That I think is great that we introduce it in a conversation like this, and remind ourselves of all that. You touched on peer support. It's something that, at least in our experience, extremely relevant. Peer support needs to be supported, meaning that you need to build peer support networks and nurture them over time. They can be very effective, from peer support workers to recovery ambassadors, recovery champions, well-being ambassadors. As long as they are developed and nurtured, can be very cost effective as well, because you create that network that then is sustainable without the need for a huge amount of investment. And it's all part of that, if you want, cultural change that we're all going through in terms of, workforce support and well-being. So I'm really glad that you mentioned it, Nicola. It certainly resonates a lot with us.
Can I just come in there? Just this a point of fun. The one thing about social care is there's always fun going on. And I think just recognising what staff did through the pandemic when families weren't coming in, they, I think it's, was kind of amazing, and it is every day. And I think it is really, really important. And to Nicola's point about that integration and rotation of staff, one of the things as I was just leaving Chelsea, I've started talking to our local NHS trust about was actually, particularly as we were talking about nurses in ITU who were like burnt out saying I'm leaving, was there a chance for them to come and spend some time with us just for some respite and re-engaging with actually what nursing's about? Because in that care home setting in particular, that is a nurse-led service. It is the absolute essence of what nursing's about. So I think that we should be selling that to NHS colleagues as an opportunity, and then the opportunity to the kind of advanced clinical skills and upskilling. So there's some real mutuality of support there that we really should be building on. So I completely agree with you.
Jennifer's made a point in the chat, which I think is an important one. She says, why would anybody go back to social care when you go to the NHS with its terms and conditions, etc.? And whilst I appreciate that, Jennifer, and I think we do need to really look at terms and conditions and align them, I think one of the things that I often do is I talk to people who've left the NHS to come to social care, and they give me a raft of reasons why they've done that. They prefer the autonomy. They don't like working in a large organisation, to the point that Nicola made. They like it when somebody can say, yes, you can have a new chair, rather than filling in 97 forms to be told, no, you can't. So there are some elements in social care where people feel that their skills and their professionalism is more respected. And I think one of the things we need to do is start looking at what those things are and then trying to package them to make it more attractive. But to your point, Jennifer, you're absolutely right. We have got to also look at the underpinning way in which we fund and reward and remunerate and train people who, in effect, they are doing the similar jobs. The people are the same. People are in a hospital 1 minute, maybe in a care home the next. And yet we've got this vastly differential approach to how we support the staff. And we need to really recognise that in the new world, that we're going into, it's about the complexity of people that you support. And you do that in a way that enables them to live well. And that is a very, very skilled occupation, and it needs to be properly rewarded. And, people often talk to me about things like, do we have a national living wage or whatever? Well, I want to see social care taken right out of that conversation, because I want it to be in a stratosphere way above the living or the national minimum or whatever wage we talk about. This is a profession, and it needs to be professionally rewarded, respected and trained in that way.
And I think Martin's right. I think it's really important what Maggie's put in the chat actually, is that staffing and staffing levels is what's leading to burnout. I think that is absolutely the key. I think it's exactly the same in hospital, although the pressures are different. I think what is really, I think staffing is, if you were to ask most people what they're most worried about, it will be staffing. And as a manager, it is probably the most stressful thing. And the worst thing about it is that sometimes you're moving people from one place to another, when the worst thing to do is put them in that position, or leaving them in a situation that you have no choice, but it's just not ideal. And I think you feel a real burden for that as a manager, and I think it really, really affects the staff. What I'm worried about nationally, whether it's social care or the NHS, it's all about what operationally we've got to deliver, whether it's the amount of people we look after. But what really isn't given enough talk is how are we going to retain our staff? And I think there genuinely is a burning platform with regard to recognition and retention, because we can't do any of the things the government is expecting us to do, whether it's NHS or social care, unless we do something about staffing levels. I think it is a really, really important point. And I think making it a career and a valuable career, because what I sometimes see is the best people are struggling because they can't do a good job, and they are the ones that sometimes leaving behind some of the people which I wouldn't mind if they went and worked in Sainsbury's. So that's the very genuine challenge that I think we've got.
And that's back to what we're saying in terms of, really upping our level of thinking about our workforce support in a different way going forward, in a more sophisticated way, in a more funded way, and a more innovative way, which obviously is a lot of what we discussed today. I'm sorry if I will need to bring this to a close in a few minutes, and well, that's the way it is, isn't it? An hour goes very quickly. Just want to say, I'll say a few thank yous at the end, but before we do that, can we go back for a second to where we started, a call to action? If I may, or having the privilege of having the three of you on a panel is that you can make things happen as much as having the pleasure to, to share your thoughts with everyone. So may I ask you, each of you, if you wanted to take away an action from this conversation that is going to help to improve or transform workforce support and well-being for years to come?
One thing I think we need to do, and particularly if we're going to have an integrated system, is we need to align measures of success. And those measures of success need to be about people and outcomes, and they don't need to be about organizations and processes. So I have three very high level measures of success. And I think if the whole system worked to these, they are very high level, we wouldn't go far wrong. So the first is the person experience. How does somebody who's using this service experience it? Does it deliver what they need and what they want in a way that supports them to live well? The second is about making sure that we get some outcomes. Those outcomes can be clinical, they can be social care, they can be whatever. It might be well-being, it might be about connection with community, it might be mental health, but there has to be some outcomes from the intervention. And the third one is about how we use efficiently the resources available, whether they're human or whether they're financial. And on some levels, I have a real concern that at the moment, we often talk about wanting more money. I'd like to have a root and branch look at the money we've got and see how we could use that more effectively for people's outcomes. And part of that is about downstreaming the issue of prevention and making sure, just as Nicola and Deborah have said, making sure that people don't go into the crisis. At the moment, what we've got is not a health and social care service, it's a crisis service on both those levels. And we need to shift the dial to being about supporting people to live well.
Martin, thank you very much. That's extremely powerful. Nicola and Deborah, we've got about a minute. Sorry about that, but it'll be great. An action for you.
Well, one of the things that I have committed to recently, which I'm ashamed to say I haven't done in previous chief nurses' jobs, is trying really hard not to actively recruit from nursing homes. Many years ago, when I was first a chief nurse, as long as my wards were staffed, I felt better. I think it's a bit like sustainability, to having a lot more responsible view with that. I'm trying really hard to recruit in different areas with a different pool of people, and maybe it's maturity. I'm getting old. I want to be far more collaborative in how we, not just I'm all right, Jack, in how we work together much more in the staffing crisis. So that is my commitment going forward, and has been recently, is much more about we've got to work together.
Very powerful. Thank you very, very much, Deborah.
I wouldn't disagree on any of those, and I suppose my job working in government, with the government, is actually picking all those points up. But for me, it's about, my plea is really that we change the narrative and perception around social care, both from a workforce point of view, a user point of view, and the public's perception of it. So that for me will be, and that has to be everybody doing it, not just people, centrally. That has to be absolutely every one of us. I think it's also for me, of course, sorting today's problems out, but thinking of that future workforce. How do we influence and change those experiences of undergraduates today to make the future better? So having a bit of a strategic think and look around this. And the other thing for me is about reward, and reward and recognition. Absolutely vital. If we don't get that right, that affects everything else.
Thank you so much. Thank you, Deborah, Nicola, Martin. Very powerful, enjoyable conversation, and hopefully some powerful follow-up. I just like to thank everyone who attended, not just for attending, but for what you do every day, because I know what our audience sees today, and it's just a sincere thank you. You know, we're all extremely grateful for what you do every day, as much as for being here with us today. Following this, we'll share with everyone the key outcomes of today, but also the actions and the commitment that we're going to take away. And then there will be follow-up. We're going to develop not just the conversation, but we're going to develop this commitment to workforce well-being throughout the year and well beyond. The next stage, the next stop is the Care England conference on the 23rd of March in London, in person as well. I think we're all desperate for some of that after the last 2 years. So hopefully see you all there. But we're also planning an event later in after the summer, specific on workforce well-being, integrated for health and care. And everyone in the audience interested in contributing to that, participating to that, please get in touch, because we're shaping it now and would really like contribution, active contribution from everyone at all levels in health and care organization. On that note, a couple of minutes late, apologies for that, but thank you all very, very much. And together, I think we can really transform staff support and well-being, hopefully for good. Thank you all very much. Thank you.